Hi, welcome to a new demo of HeyMOE. Hey, hey, hello, hi, how are you doing? MOE stands for Medicare Open Enrollment, so MOE. HeyMOE.com is where we live and breathe. Now I get to show you around HeyMOE. Are you ready? What I'm going to do is I'm going to log in to my demo account. Welcome to the agent dashboard. If you are a Medicare insurance agent, this is your HeyMOE home. On the agent dashboard, you will be immediately presented with a link. This is your link to share to your clients to make sure that your clients, show up on your agent dashboard, allowing you the ability to see what they're doing and to get credit for their subscriptions and signups. So be sure to share the link with your clients or post it on social media, on your website, etc. Your link is right there. Then through your HeyMOE agent dashboard, you can track progress of the signups of your clients. So you can see, for example, right now under my sample account, I have 5 active referrals that have resulted in 3 subscriptions that are paid, earning me $10 per person per year that they remain renewed with HeyMOE. Then down below, you can actually see the client's name. So you can see Michael Jackson is pending, not officially signed up, but Karen Smith, she has signed up, and she's even given me the ability to see her account and even edit her account for her, adding or removing prescriptions, altering, editing prescriptions as needed. Again, you can access your clients' accounts if they give you permission. They are in charge. It's their account, their information. They can revoke your access at any time, but maintain that relationship with the clients. I'm sure they'll continue to give you access because you're there to help them if you want access. So feel free to edit the prescription medications, the pharmacy they prefer, the plan they are enrolled in, as well as see results of the client. And if a client is having a problem logging in, very, very common for clients to call you up and say, hey, that HeyMOE account I have, I don't remember my password and I'm having a problem getting into my account. Right here under the 3 dots, you can send them a new login link. That link comes via email to their account. By clicking on the link, they bypass password altogether and can access their account. So hopefully they'll reach out to us at HeyMOE in order to help them with their account and access. But we know that you are the first person they think of, their trusted agent. So you have the ability to send them a user login link. That is the agent dashboard. Now, if you want to actively add a client yourself, let's say you are doing an initial enrollment. You have just picked out a supplement, Medigap policy for your client. You don't want to send them out the door without helping them with a Part D drug plan. So what I'm going to do is I'm going to, in my dashboard, add a client. I'm going to show you how this works. So let's say my client's name is Donald Watson. You add their email account and you confirm that the client has explicitly given you authorization to access their account. So you want to make sure that they are participating in that confirmation check. Then create the client account. When you create the account, you enter their name, their zip code, their current plan if they have one. I'm going to enter a zip code in Wisconsin. Then confirm that they are not enrolled in any Medicare Advantage plans, federal employee health plans, Medicaid, VA, TRICARE. It's not for any of those particular things, their HeyMOE account. Then current prescription drug plan. If you're using HeyMOE for initial enrollment, your client will not have a plan. But if they are using HeyMOE for open enrollment, feel free to choose the plan that they are currently enrolled in. When Medicare Open Enrollment comes around, they will automatically receive an email notification letting them know the results of their plan comparison through HeyMOE. But I'm going to go with I don't have a plan right now. Then I'm going to add in 2 prescription medications. I'm going to add in Skyrizi. I am going to say that my client takes an auto injector and they get it refilled once every other month. That's very common for Skyrizi. I'm going to click next. Then I'm going to add a second drug. I'm going to add Cialis. Super fun drug. I'm going to actually say that I want to use the brand. And we're going to say once a day. All right, those are the 2 medications I am going to add for this client. Then you select the pharmacy that the client actually uses. So let's say that the client uses the Aurora Hospital Pharmacy. All right, then we just review basic information, primary zip code. I don't have a plan. I've got these 2 drugs. Here we go. To subscribe, it's as easy as putting in the client's Apple Pay information or their card information. Just grab payment information there. By using your login link, the client gets $5 off of the HeyMOE $30 annual subscription fee for the first year. After the credit card information is provided, now we're back to the results page. So, are you ready to see your results? Very, very exciting. All right, I'm going to confirm that the information above is complete, accurate, and up to date. And HeyMOE immediately begins processing the medication list, looking at the pharmacies, looking at the medications they take, looking at refill frequencies, looking at brands versus generics, and up to 20 local pharmacies, all to find the best coverage and the best cost for the clients. This is what we call the weight page. The weight page means that HeyMOE has found changes that can save, in some cases, significant amounts of money for your client. So the changes that HeyMOE is suggesting the client consider in this particular case is changing Cialis from the brand to the generic. HeyMOE automatically compares brands to generics and generics to brands looking for coverage and cost savings. The second thing it is suggesting is changing the Skyrizi refill frequency from once every other month to once a month. Let's say, for example, that the client says, no, I don't actually need it that often. Notice that it was currently $85,000 worth of cost savings. By changing to getting Skyrizi refilled once every other month, back to once every other month, we're only saving $1,700 now. I think I like the idea of saving $85,000 a lot more than saving just $1,700. So I'm going to change this back to yes, I'm going to get Skyrizi refilled once a month. All right, I've reviewed these changes and then we're going to move beyond the weight page to actually see the plan recommendation. Based on the information, the drug list, the pharmacy, the plan that is best for the client for the rest of the current calendar year is WellCare Classic. It is always calculated based on the assumption that the client will start the Part D drug plan the first day of the next month. The client will hit the out-of-pocket spending limit on the WellCare Classic plan using the Aurora Pharmacy. You can then scroll down and see the coverage details. The plan does have a $615 deductible. Skyrizi's refill costs are on average going to be $386 per refill. And Tadalafil, the generic rather than the brand, will be $33.54 per refill. You can see then all of the different pharmacies that the client could get their medications refilled at. There's a variety that the client could choose that yield the out-of-pocket spending limit. All right, then you can see the estimated monthly drug costs. So in August, the client is basically going to hit the out-of-pocket spending limit 1 month and we're done. You can also see all sorts of different costs on different plans. So if the client chose one of several plans, they would face nothing more than the out-of-pocket spending limit. So WellCare Classic, WellCare Value Script, Humana Value, Humana Basic, Health Springs Assurance, AARP, Medicare RX Saver. All of these plans have the same total out-of-pocket cost for the rest of the year. They are ranked by star ratings and also alphabetically. Technically, the client could choose either the WellCare Classic plan or the WellCare Value Script at a 3.5 star rating. If you want to check details on other plans, let's say your client does not like WellCare, go ahead, click on the name Humana Value, and you will be able to see the details for the Humana Value plan popping up. We still have a $601 deductible. Refill costs for Skyrizi are $419 per refill, and you can see the costs at different pharmacies, the spending schedule. You can always check plan details for all of the plans. Then you could print the screen. HeyMOE is a very clean, very easy to use PDF. It's very nice to hand to the clients. And those are the results. If you have any questions about the agent dashboard, how to sign up to become an agent, or anything else, please feel free to reach out to us at info@HeyMOE, HeyMOE.com, or visit our website at HeyMOE.com. And there is a specific section for insurance agents. Thank you so much for hanging out with me for this demo. Reach out and let us know if there's anything we can do for you or ways to improve HeyMOE just for you. We are all ears. Have a good one.